When we designed the studio, we very much focused on technology-driven support, so things like virtual reality. And then we had a conversation with our medical simulation unit on campus, and what we felt was that the technology, yes, really important, but it could be distracting from the human aspect of empathy.
Hello and welcome to the Pathway to Impact podcast series. My name is Madeline Arkins, Research Project Officer at UIN and your host for today. For this episode, we have invited Dr. Natalie Walsh, Director of Entrepreneurial Development at the University of Galway, to discuss the Empathy Studio, a unique initiative that immerses students in the experiences of others to inspire human-centered solutions. We'll learn how this approach is reshaping problem solving at the university and why empathy is crucial in innovation. Today, I have the pleasure of speaking with Dr. Natalie Walsh on this topic. I also had the privilege of moderating a session with Natalie at this year's UIN conference where Natalie was presenting, and I found it really fascinating, so I'm sure it's going to be a great discussion today. Natalie is the Director of Entrepreneurial Development and co-lead of patient and public involvement in research and innovation at the University of Galway. She brings with her over 17 years of experience in higher education and expertise in human-centered design. She has held senior roles in the College of Medicine, Nursing and Health Sciences and in the Office of the Vice President for Research and Innovation. In her current role, she drives innovation and entrepreneurial thinking at Ideas Lab, which is the University of Galway's hub for innovation and entrepreneurship. And she somehow also has time to complete an innovation fellowship at Stanford University. So thanks, Natalie, for fitting in time to come and speak to us.
Thank you. It's lovely to join you this afternoon.
Thank you. Maybe just to get us started, Natalie, for the uninitiated, can you share a bit about your work at the Empathy Studio, maybe how you came to the Empathy Studio, and indeed how the studio came to be?
Yes, so about 4 years ago, the Irish government launched a call for innovative risk-taking projects. And we looked at the blank page like all of us do when these opportunities come and thought, what can we do? How could we make a difference? And what's novel and unique? And we had been working in design thinking for about 4 years at the time. And one of the challenges that we identified was, how do we really immerse students in the empathy stage, particularly because we're asking them to solve a problem that maybe they don't understand or identify with. How can we support them to walk in the shoes of the person, to understand that lived experience, so that when we are inviting them to ideate and to define the problem, that they're doing it from a person-centered perspective and that they are considering the lived experience. And really that was the genesis for the Empathy Studio. We have a sister program on campus called BioInnovate Ireland. They're a Stanford affiliate as well. They're part of the biodesign group. And we were always fascinated by the first stage of their program, which is called immersion. And they get to go into a clinical setting. So they get to spend about 2 months in the hospital and they're observing and they're interviewing and they're writing as many needs statements as they can, with the view then that they'll narrow that through the second stage of the process and identify an unmet clinical need. So we took inspiration from them and the opportunity of the proposal to create the Empathy Studio. And it was launched about 2 years ago formally. And we've put it through about 5 or 6 different programs at this stage. Still very much in piloting, in that I think it's one of these areas that we're always going to be learning and growing and curating content and material for. But it has become a real focal point for us on campus in terms of giving students access to environments and simulations and understanding the lived experience in a different way, particularly as we stage gate them in terms of access to what may be a patient group or a vulnerable group, so that we're considering the entirety of their experience as learners, meeting them where they're at and expanding their skills on the journey.
Yeah, fabulous. And maybe then getting into the nitty gritty of how that is done. In the description for this event, we alluded to some virtual reality applications. Can you tell us a bit more about the sort of techniques that you guys impart?
Absolutely. So on paper, when we designed the studio, we very much focused in on technology-driven support. So things like virtual reality. And we invested in some virtual reality. We invested in some medical grade simulations. Some of them you'll see behind me. So we have a baby, we have a person, so I'm surrounded. And then we had a very detailed conversation with our medical simulation unit on campus. And what we felt was that the technology, yes, really important, but it could be distracting from the human aspect of empathy. And we went back to the drawing board and thought, okay, how can we still democratize technology and give students access to cutting edge material, but not take them so far away from the human experience that they lose sight of that and the importance of that in the innovation journey. So where we've actually invested most of our time and effort is around human simulation. And that is role playing, that is acting. We do some forum theatre as well. And what we found through that is we're heightening the human skills of the students in terms of communication, deeper understanding of the problem, because they can probe and ask questions, completely transforming the solution directions that are coming out. But we can still support them or scaffold their experience by using technology like virtual reality. And it's really powerful, maybe in a context where we know, for example, we cannot drop a student into an operation theatre unless they're a medical student specialising in surgery. But what we can do is we can give them a walkthrough using virtual reality of what a theatre looks like, what it sounds like, what you see where your operating table is, how the different aspects around the table work, where people maybe place themselves in a surgery. And that just adds another layer of understanding to the problem. But it definitely is more the human-centeredness and the simulation where we have found has added more value in terms of empathy and students really deep diving into the problem. And it might be good to give an example of one of them here. I know when I met at the conference, we had shared the Boston Scientific Challenge and Synthesis Medical, our company who worked with us on that. So they were looking at the stoma market. So Susie, who's here behind me, has a stoma fitted. So it's an opening on the body. Multidisciplinary student teams got to understand exactly where physically the stoma is located, how it operates in terms of the colostomy bag, how you clean it, how you put it on, take it off. We then got them to wear a colostomy bag and filled it with water and asked them to walk the campus. Some of them struggled to close their trousers because they weren't used to the extra width around the waist that it required. Some leaked, which is part of the lived experience of people with stomas. And we asked them to use a bathroom facility as well on campus, just to see how far the sink can often be from the toilet, unless you have a disability toilet, which are limited in society still. So we really got them close to the problem. At that stage, they spent a couple of weeks working on their empathy mapping and their stakeholder mapping. Then they had an understanding of the problem from a technical perspective more than anything else. We then got them to spend time with a stoma nurse in our hospital, and they queued, they waited their time, they had their appointment and what a first appointment looked like. Again, we brought them back. They're still working through their empathy mapping, a deeper understanding. And at that point, then we introduced them to a panel of patients who work with us. And what the patients at that point, they understood some aspects of the experience, of the lived experience, but they didn't understand it from the person who lived experience it was. So it was critically important that we connected them with people who are living with stomas and colostomy bags. So we did that, and that was really powerful because the types of questions they asked were really thoughtful and insightful, and were around the day-to-day life, the challenges, the adjustments, where the patient or the person living with the stoma felt that there could be an enhancement, and what their experience engaging with the hospital looked like, what waking up from that surgery looked like. Because I think for a lot of people, it is quite, I won't say stressful, but it is quite overwhelming when you have your surgery and then your entire life routine since you were a toddler learning to use the toilet has totally changed. And there's a vulnerability in that. And how could we help and work with Boston to specifically look at a care point at the post-surgery stage to reduce readmittance? There's an ethical perspective to it in terms of we want them to do it true to the challenges that patients are facing. We want to look at it societally in terms of making sure they have the best lives they can, and it's not a limiting factor. But there's also a commercial case. So stoma market is a growing market. And from Boston Scientific's perspective, they want that three-pronged approach where it's considering the lived experience, the commercial opportunity, and the impact on society and the health system. So by engaging with the Empathy Studio, we could touch on all those points and create solution directions that were more fit for purpose.
It's amazing when you're describing this whole process, just to understand the patient point of view actually requires the involvement of so many different actors. I know that the Center for Drama and Performance are also involved in those enactments that you described, and having Boston Scientific and Synthesis Medical involved is also, yeah, really a value add. I'd love to hear more about that particular collaboration because we at UIN, we love hearing about university industry collaboration and how that works out. Can you tell me a bit more about that partnership, maybe how it came about and what was the clincher in its success, maybe?
So from our perspective, again, going back to this proposal opportunity, it hugely focused on skills development and skills for industry and responding to a deficit in skills around innovation and entrepreneurship. We were finding that people have really good technical skills. We have brilliant engineers, we have brilliant scientists, but it is looking at life through a different lens when we talk about innovation and entrepreneurship. Communication skills, again, back to the term soft skills, which I'm not a fan of. I prefer human skills, and I think we'll see an increase in the term human skills. And we met with Boston Scientific and said, we have this fantastic opportunity. We have a blank page. We would love to work with you, but we also need to be really considerate of your time and the effort that you put into the relationship, because it is taking from their core day jobs and core roles. So we developed, very much modeled on the UIN engagement framework and approach to working with industry. And from that, our relationship has grown. We started during COVID. So we started in a virtual world, and Boston Scientific put their hands up straight away to run what we call an enterprise challenge with us. Our first challenge out was actually something that we could ask the students to do at home to a large extent. So the first challenge we looked at was stent preparation. So a stent nurse has to prepare a stent for surgery and placement in the heart. And she or he has to hold their hands in freezing cold water for 9 minutes to prepare the stent. And the stent is similar to threading a needle as well. So if you can imagine threading a needle underwater in freezing cold water for 9 minutes, that's what a nurse does to support the surgeon in terms of surgery. So immediately, that's something that we can ask the students to replicate at home in their own environment, so that they then have an understanding and an empathy of what that nurse's role looks like. And again, we could then facilitate an online session with a cath lab nurse, and they were mentored by Boston every week as well. So again, you're getting that multiple stakeholder perspective. And in this case, they got access to speak with surgeons, and they got access to nurses and hospital staff. So it was really powerful in that regard, and very low fidelity. A needle, a thread, and cold water, in essence. But it does require the contribution of experts and people. And we're really, I suppose, we're really structured in our approach to that, in that it's short time, it's very student-led in terms of the mentoring and the questioning. And the students, they work on the project during the week and they meet the mentor on a Friday morning. But it has worked really well, and we're now going into our 4th year working with Boston Scientific. They will be back in with us in January, and we're onboarding our other companies for semester 1 engagement, but Boston are a semester 2 partner, so they tend to rotate in semester 2. Our last challenge was around sustainability. So we're not just looking at medtech, and I think that's the beauty of empathy, is it sits in every sector. So sustainability was our challenge last semester. And similarly, we could give them access to understanding from a medical device company's perspective what sustainability means, if they have an infringement, the penalties that are attached to it, but the importance of equipment and medical devices have to reach their destination in prime condition, sterilised, and all the challenges that are faced in terms of transiting across the globe under that, and now trying to do it in a highly sustainable way. So it has worked really well in all of the situations we've tried it. And it also gives us a chance to explore, to have some fun, to be creative, and to practice what we preach in terms of coming up with the empathy experiences and making sure that they're scaffolded through the weeks of the programs that we run.
Amazing. And it's also great to just hear of a scenario like that where a partner joins for one sort of initiative, but then it grows into something more long-term that is both a value for them, the students, and for the Empathy Studio. I wanted to touch on something you mentioned, which was human skills and soft skills, and why perhaps there is such, I don't want to say war, but maybe conflict between those that feel that technical expertise maybe trumps all in many fields, and that these human skills are kind of left to the wayside or not deemed as important. How or why do you think they are so crucial, particularly in areas of innovation?
I think they're so crucial because they're what differentiates us. So I like ChatGPT or artificial intelligence is what's the word of the year. And when we're now doing our programming, we introduce AI because it is the calculator of tomorrow. It is going to run alongside us. It's going to become a core part of how we operate. But to successfully leverage technology, I actually think you need heightened human skills, and particularly around things like critical thinking. There is a huge amounts of misinformation out there. And like I use ChatGPT, and as much as it's really useful for some efficiency, there are times when I'm looking at the outcome and I'm going, oh my gosh, I know that's not right. And I think that's really important in terms of sense checking yourself and understanding your critical thinking and keeping it fresh and not being overly reliant on the outputs. Taking the time to curate your questions, to attempt to respond and to build your solution directions, and then leverage technology when you need to, or when it makes sense from an efficiency perspective. So I don't think it's ever going to be an either or. I think it is a both, but not one at the cost of the other.
Yeah, that's a great way to put it. Before we jump into questions from our audience, I'd love to ask you something that came up while you were presenting at our conference that I think was a great question, and probably one that a lot of people are thinking of when you think of how to measure, do you measure the success of the Empathy Studio? And in terms of how do you measure how empathy has grown in students over time?
Yes, no problem. So I think measuring effectiveness is a really interesting one, because when we started looking at tools and measures, the first place we went to was our Institute for Life Course and Society, who have huge amount of experience in social empathy and particularly activating youth empathy. Their patron is actually Cillian Murphy, and they've published a book called UNVA, the Empathy Book for Ireland. It's a fascinating read. He's written in it as well. I'll actually send you a copy, Madeline, because I have a few spares here. I'll send one over to you. And so we started with them and we looked at a few different instruments that were validated. And what we found was they were very focused on social empathy as opposed to empathy within an innovation landscape. So then we went and looked at Entrecomp. And for anybody who may not be familiar with Entrecomp, it is a suite of supports, tools and assets developed by the EU that help you to understand innovation entrepreneurship at institutional level, but there's also tools there, specifically one called EPIC, that helps you to do pre and post assessment. It has 442 learning outcomes. It's a complex beast.
Wow.
But 4 of the learning outcomes are specifically linked to empathy. So we did a lot of mapping and we identified the questions that linked back to empathy, and we issued them to surveys. So we do pre and a post. And what we found through them is that there was an increase in the empathy of our students who had taken part in a program where the Empathy Studio was attached. Just the last couple of weeks, and I'm fiddling here on the desk, we've come across some other work that happens in Jefferson University in the States, and they have a model called the Jefferson Scale of Empathy. And we're going to look a little bit more at this because we're engaging more with our College of Medicine, Nursing and Health Sciences. And so within it, there's 20 questions. It's statistically valid. It's been tested numerous times, and it's now being used outside of the clinical setting or outside of the medical student setting with other student groups, which is really important because we are multidisciplinary. There will be a medical student or a student from health sciences on every team, but not every student is a healthcare student. We've been through the questions and we think a lot of them apply. And what we're going to do is we're going to meet with our colleagues in ILAS to see, could we take an adapted version of this or this as it is? And could we actually trial it through one of our programs this semester coming? Because it's a really nice instrument. Some of the other tools that we looked at were more around describing a time you were happy, describing a time you were sad. And we just felt they weren't appropriate to what we're trying to understand. And if we can kind of embed this, what's really nice is we may get the opportunity to look at this more longitudinally and work within a module within our School of Medicine at first year med, and then later as they're developing their professional selves. So we'll actually may be able to look at it longitudinally. So very exciting.
Yeah.
I never thought I'd say evaluation was exciting because I'm not an evaluation person. But it's actually really exciting to see the potential and to see the instruments that are there that now we can see huge value in kind of maybe deviating off the path in terms of how we would evaluate it previously, and look at some other tools that may give us better depth and breadth of understanding of empathy.
Yeah, and what a win to be in the development to build a module for year one, because I feel like that year one for health science med students is so critical in how they look at their career going forward. And I remember and recognize the Jefferson scale because of there was some sort of 2017 study using the Jefferson scale to look at the HPAT, the Health Professionals Admissions Test in Ireland, which is for those not in the know, was another kind of factor of assessment used alongside the academic scores for med students to go into college. And that is supposed to measure bedside manner, communication. And I guess against the Jefferson score, it did not score so well.
All the human skills.
All the human skills exactly needed in health sciences. That was very useful. Thanks, Natalie, to hear the evaluation side of things. Looking at the wider entrepreneurship ecosystem in Ireland, because Empathy Studio is, of course, part of the Ideas Lab. I just wanted to know how Empathy Studio fits in the wider entrepreneurship ecosystem in Ireland and your perception of it in the last few years.
We're seeing an increase in human-centered design being used in Ireland. I think there was definitely in the last couple of years, a number of institutions have really developed expertise in it. So we've seen an interest in our approach to empathy, and we're also really interested in terms of what other people are doing. I think programs like the Stanford Biodesign program and the term immersion are also increasing, and some of that is in relation to a call that we had in Ireland called the Innovators Initiative, which was launched last year. The University of Galway secured funding for their BioInnovate program through it, but there are other innovator initiatives. There's one in Connected Health in the East. So I think there are 3 or 4 funded, one per region, but they all take this approach to immersion, and then there's filtering, and then there's a commercial of needs. So I think that will drive more of an empathy focus in terms of the immersion piece. And then obviously we have IADT in Ireland as well, the Institute for Art and Design, who are doing phenomenal work as well. So I think there's a really nice synergy across our institutions, and I think there's a critical mass. I think I would love to start seeing more European projects and proposals with a focus in on empathy, because, you know, while we look at it through a commercial lens here or through an innovation lens, there's societal impact as well. We know for things like war, we know for things like rioting, empathy does not happen at the extremes. So as far as we can support people to be empathetic, it means they don't exist in the extremes. So we could have a much nicer and kinder society if we could embed more empathy education and training. So from my perspective, I think it's fantastic to see it where we are doing an innovation and entrepreneurship, but it is such potential nationally and internationally for us. And colleagues in ILAS, they actually have developed a suite of programs for primary and secondary schools to introduce empathy earlier. And there's even a baby program. Young mothers bring their babies into schools. There's a charity group in Ireland, Roots of Empathy, and it introduces children to empathy and understanding babies and kindness. So I think opportunities like that are huge. But I think, again, the innovation and entrepreneurship space is so transformative, and it's such a place of change that we will create better solution directions that are more useful to society if we actively engage in it. And I'm delighted to be part of something where we're seeing the value of it and are working to spread the word through things like today with yourselves.
Oh, that's a very poetic note, Natalie. And I entirely agree about more European projects on this topic, because sometimes, there's an idea that the more like morally high something is, the less that money should be involved. And yet it's exactly the opposite. I feel like we entirely should be putting our efforts and resources in something like this that is so crucial. I am conscious of our time. I do see we have a question from Mary asking, can we get involved with the Empathy Studio? Natalie, if people want to get involved or keep up
just drop me an email. Yes. So I can pop it into the chat if that's the most convenient way to share it.
That works, of course.
Yeah, feel free to reach out. We're really interested in partnering. We're really interested in exploring it as a topic, hosting people as well. If people are interested to come and see it, we'd be delighted to do that as well.
Fabulous. I think it's such a fascinating topic. I could definitely ask you many more questions. But it's amazing that on anything to do with technological advancement, we always talk about the rate and pace of change and disruptors. And yet with fundamental skills like empathy, it really is so constant. And it's heartening to see that such initiatives are at the Empathy Studio. and championed there. So thank you, Natalie, so much for your time, and thank you
all.
all for joining in.
Lovely to be here with you. Take care.
Thanks again, everyone.
Thank you for listening to the discussion. Follow UIN on LinkedIn, and if you're enjoying our podcasts, make sure to subscribe, rate, and review on your podcast platform of choice to help others find this content too.